Okay, so hi everyone, my name is Kendall Raby, and this is my final presentation. So the topic I chose to research is health and wellness coaching. The reason I chose this topic is because I'd like to help educate others on maintaining a happy and healthy life. Health and wellness coaching is important because it promotes wellness medically, emotionally, and physically. This career field covers all aspects of wellness to help people live longer, healthier, and happier. So I am currently working on my bachelor's degree in sports and health science, so this career field is closely related to my field of study. Ever since I started incorporating healthy habits into my lifestyle, I have felt much happier and confident. If I choose to pursue this career, I would like to show others the benefits of living a healthier way of life as well. And you also hear a lot of people say that being healthier means being happier. So some of the topics that will be covered in my presentation is what is a health and wellness coach and what do they do, what academic requirements or training is required to pursue this career field, what type of settings do professionals in this field work in, and what makes a health and wellness coach successful. So to get started, let's talk about what health and wellness coaching is. So unfortunately, because there was no clear definition on the job duties of a health and wellness coach, there were many systematic analysis on medical texts to help find a description to this sort of career field. According to the International Consortium of Health and Wellness Coaching, health and wellness coaches partner with clients seeking self-directed, lasting changes aligned with their values which promote health and wellness and thereby enhance well-being. In the course of their work, health and wellness coaches display unconditional positive regard for their clients and a belief in their capacity for change and honoring that each client is an expert on his or her life while ensuring that all interactions are respectful and non-judgmental. So, upon finding a clear definition of health and wellness coaching, an article by Ruth Wolliver, Meg Jordan, Karen Lawson, and Margaret Moore performed a job task analysis on the job duties within this career field. According to the article I found, it says that importantly, health and wellness coaches help the patient strengthen motivation, establish systems of accountability, and integrate their own learning and how to best shift their behavior in the context of their own life circumstances. Also, by being able to find a concise job description of this career, they are then able to create national standards for testing, exams, and certifications needed to become a health and wellness coach. So, what must you do academically to be qualified as a health and wellness coach? So before we move on, I just want to show you guys a video from an actual health and wellness coach that talks about the new emerging career field.
Will health coaches be the future of healthcare? Full disclosure, I'm a health coach myself, and this video series is funded by the Institute for Integrative Nutrition, the school that I graduated from in 2012 as a certified health coach. So, of course, I'm a little biased, but I'll just lay out the facts so you can decide whether or not health coaches are truly the future of healthcare. Currently, 66% of the American population is overweight or obese. 1 in 2 American men and 1 in 3 American women will get cancer at some point in their lifetime. Pretty scary, right? We spend close to $3 trillion a year on healthcare, which is more than 17% of our GDP, and the highest rate compared to any other country in the world. So, what's the problem? While doctors are trained to diagnose and treat specific illnesses, they are not trained in how to change the behaviors that lead to them. Now, a new breed of healthcare professional is filling that gap and working with patients in the weeks and months between their regular doctor's appointments to help them change the very habits that cause those chronic illnesses.
A health coach is a supportive mentor who helps clients make healthy lifestyle choices. Whether the goal is to lose weight, increase energy, or sleep better at night, a health coach motivates individuals to make lasting changes and feel their best. Health coaches work in conjunction with physicians, nurses, and dietitians, and serve to fill a void in our current healthcare system.
Some of the nation's biggest employers, such as Johnson & Johnson, are hiring health coaches to cut down on medical expenses and lost productivity. Even medical doctors, like Dr. Frank Lipman, are starting to keep health coaches on staff, and many health coaches, like myself, run their private practices where they counsel clients one-on-one or through group programs. But are people really ready for health coaches? Most of the population still doesn't even know what a health coach is. Some programs are a scant 2 weeks, while others, like integrative nutrition, qualify for master's level classes. Developing a national education standard, which is currently in the works, should help push the movement further into the light. Now, I want to know what you think. Could health coaches really help shift the global health crisis? Or are you hesitant to accept this as a new form of healthcare professional? Let me know in the comments below, and if you haven't already, please subscribe to this channel. I'm Maria Marlowe, and thank you for watching.
Our body is like an amazing biocomputer.
Okay, so I think that's a great video kind of going over what health and wellness coaches do and how they kind of work in the workplace as well. So as we move on, we're going to talk about the academic requirements. So I kind of broke it down in 3 steps for you to make it a little bit easier. So the first step is to earn a degree, normally a bachelor's degree. They prefer the degree to be in counseling, psychology, or sports and health related fields. The second step is before becoming certified, you can gain experience by getting an entry-level job into the field. This will help in getting clinical hours, which is needed to become certified as well. And then the last step is to take national exams to become certified. Okay, so I'm going to talk a little bit about nationally certified by NCCHWC. So within another article called National Training and Education Standards for Health and Wellness Coaching, The Path to National Certification by Ruth Wolliver, Meg Jordan, Karen Lawson, and Margaret Moore, they stated the minimal educational and training requirements needed to sit for the NCCHWC certification exam. So basically what this includes is a clinical license, bachelor's degree, at least 2,000 hours of work experience in health or wellness setting, knowledge of basic healthy lifestyle principles, completion of practical skills evaluation, and 30 real-time contact hours in which the individual is developing their practical skill. So, according to Meg Jordan, Ruth Wolliver, Karen Lawson, and Margaret Moore, national standards are needed to bring a greater evidence base to the field of health and wellness coach. To help health and wellness coach educators and trainers a benchmark for education and training, and to offer the public a means for readily finding and working with well-informed health and wellness coaches who have demonstrated core competencies through assessment of knowledge and practical skills as determined by a national standard. So, once you've become certified, you are now able to show your skills and knowledge you have obtained within the workplace. But where can you work with this certification? So some types of settings people work with in this career field are hospitals or medical settings, which are the most common, clinics, private office, self-employed, which is like the lady in the video, fitness centers, and wellness centers. So first let's talk about the medical setting. This is the most common for a health and wellness coach. This includes places like hospitals, clinics, or any other medical settings. They normally work within the healthcare team along with physicians, nurses, doctors, whoever, to provide health and wellness services. What they do in a medical setting is educate patients with chronic diagnoses on health and wellness, suggest diet and exercise plans to improve health. An example of this is maybe to help someone with diabetes get on a healthy diabetic diet. They also help with behavioral issues to improve overall well-being. They can suggest mental stress reducing techniques to improve overall health. And also, they provide consultation and advisement to patients' needs related to health and wellness. Not only do health and wellness coaches work in medical settings, but they can also work in fitness centers and wellness corporations. Most of their duties in this setting include helping clients formulate fitness and diet goals, as well as behavioral needs in relation to the client's overall well-being. An example of this is like if someone wants to get back into fitness but can't stick to a plan, a health and wellness coach can help kind of determine the behavioral aspect of this to kind of see why they're not sticking to the plan and kind of help motivate them to stick with it and stay on to reach their goals. According to April Durrett at Idea Fitness magazine, with a background in exercise knowledge and proven ability to work with clients, fitness pros, especially personal trainers, are a natural fit to become health coaches. Using coaching techniques within the personal fitness field can help you train your clients better and improve success rates. So like the lady in the video, she had her own private practice and she was self-employed. They can also start their own business and take on clients as they please. Most of the time they do consultations to hospitals or corporations where they can hold seminars where they talk to people about health and wellness. Some of them have their own website, blogs, and social media tools in which they connect with their clients. An example of this is a health and wellness coach may start their own messaging group for members working towards the same goal. Within this group, they can offer advice, motivation, suggest healthy diet and fitness habits, and much more. So now that we know what health and wellness coaches do, how to become one, and where they work, we now to explain what makes them successful in the workplace. So I want to talk a little bit about the job outlook and the wage. According to the Bureau of Labor and Statistics, employment of health educators and community health workers is projected to grow 13% from 2014 to 2024, faster than the average for all occupations. Growth will be driven by efforts to improve health outcomes and to reduce healthcare costs by teaching people healthy habits and explaining behaviors, how to use available healthcare services. Also, the median wage for a health educator or health and wellness coach is approximately $53,070 in May 2016. So now I want to kind of talk about success when it comes to being a health and wellness coach. The way they use their coaching techniques to promote changes is what makes them successful. Most of the time, depending on the age of the patient or client or the type of goals they'd like to meet, they have to use different coaching techniques to be successful with that individual person. Like most jobs, the more you coach and learn different coaching styles, the better you will become. Health and wellness coaches inspire, motivate, educate, and encourage patients and clients toward overall well-being. All these characteristics are what makes them very successful. This image that I have shown here portrays all the characteristics that make up a health and wellness coach. By doing all these things, they are able to become successful in helping patients and people be successful in their life goals. So according to an article within the American Journal of Lifestyle Medicine, Gary Sforzo and other colleagues performed a study on the benefits of health and wellness coaches within a medical setting. They stated that the results mainly suggested psychological benefits of health and wellness coaching for cancer patients. Both studies, about 67%, indicated an increase in favorable psychological outcomes. In addition, 4 studies, approximately 44%, suggested behavioral changes as a result of health and wellness coaches. So that just kind of shows the success of them working with patients in a hospital who have chronic illnesses such as diabetes, cancer, fibromyalgia, everything. Anything chronic, they can really make a difference when it comes to psychological or behavioral changes. Overall, the career of a health and wellness coach is still growing, and professionals in this career will be able to help patients and clients reach their goals of maintaining well-being and preventing disease and illness. So always remember that being healthier makes you happier. Alright guys, thank you for watching. Here are my works cited for my images, for my articles, and the works cited for my video I showed you guys on YouTube. Thanks for watching.